Hi. Welcome,
Hello.
everyone. Thank you for joining me, Dr. Katie. I appreciate it. Hello, everyone. Thank you for joining. If you are here, hi, Julie. Thanks for joining us. If you guys are in the room with us today, please comment with the hashtag The More You Know. We are doing some giveaways as usual. I'd like to introduce you all to Dr. Katie Kangas. She is from the Integrative Veterinary Center all the way in, where are you, California? California,
Yep.
right?
Diego, California.
California. Yep, she is one of the sponsors for the More You Know Pet Wellness Summit, and she will be there. We are less than a month away, you guys. I cannot believe it. It's been quite the year planning this, and we are so excited. For those of you who do not know, there's a book that came out a couple weeks ago, the new Forever Dog Life book by Dr. Karen Becker and Rodney Habib. We are going to raffle off 2 of those books today yep, you've got your stash in the back there. We're going to raffle off 2 books today. So again, make sure you comment with that hashtag, The More You Know. That's going to get you entered into the drawing, and we will do it towards the end of the broadcast. But yeah, welcome. Cannot wait to see you next month. And yeah, would you like to tell the audience a little bit about who you are and what you do?
Absolutely. Thank you, Amanda. And I just want to start out with some gratitude for you putting such an incredible event together, 2nd year in a row now, in
Yes,
collaborating and collecting such wonderful people in our field of animal health care. And everyone that's going to be speaking this year and that you've included in these events is all about the same mission that I am too. So I get so excited about the alignment here of just empowering pet parents. And so even your slogan and your hashtag, the more you know, that is so aligned with my purpose and why I'm here to share all of the information that I can share with people, either in a speaking set like what's coming up, or in the one-on-one, helping them with individual patient sessions. And so that's our topic today, of how any holistic or integrative veterinarian such as myself can help pets from afar. So I'm really glad that we're touching in on this topic, because I feel like, in today's sort of modern age, this is really just so on the current edge. And it's really nice for people to get a scope of even empowering themselves more with what they can do to plug into very specific customized plans for their pets. So what a great forum to, display this in. So thank you so much. And then just a little bit more background about myself is my practice. I do have a practice in San Diego, as we mentioned. I have been a veterinarian for, I can't believe I can say this, for a little bit over 30 years now. I have been doing pretty strictly holistic integrative for more than 15 years, so about half of my veterinary career. But I started out, of course, doing all the conventional, and I even did wildlife and exotics and did shelter work, and then found my pathway into my passion of, holistic and integrative. So that's what I've been doing for quite some time. The way that things have evolved over the last several years with, the pandemic and all kinds of other stuff in our society, modern society, I've evolved into doing a lot more telemedicine and even less, in-person presence in my practice. And the reason is because I can serve so many more people and so many more pets that way that aren't local to me. And as we do more podcasts and social media and all these great events, people are finding good resources. And if they're not local to those resources, it's really wonderful for them to have the capacity to get some empowerment by plugging into resources such as myself. So thank you for highlighting this for everybody.
I think it's great too. I know for having the pet supply store here, we get a lot of people all the time that's like, well, do you have a holistic veterinarian? Like, who do you use? And I do, but we don't have a lot close by, or they're really booked up because, holistic, veterinary medicine, just like with the Western side of things, there's not many to fill it right now. There's more pets than there are veterinarians. And then you make that gap even smaller, and there's not many holistic veterinarians. So I'm usually sending people, an hour plus, depending on what they're looking for. So with you doing telemedicine, for holistic health, I think it's awesome. It's a good resource for myself. It's a good resource for people to have. use it as an option. I know for myself personally, I love telemedicine for my own self. I can do it in my office. I don't have to leave work. Something that's for 30 minutes, I can do in 30 minutes that would normally take me several hours of my day. Because yeah, it's great for time. So
it really is. And thank you. It's so nice when people have had any telehealth experience for themselves, knowing that that can be, very effective, can work well, can make things much more efficient. And so that obviously can play out into, telemedicine for pets as well. Some people, though, that haven't had that experience, maybe, when they call us to talk about an appointment, sometimes they're very skeptical, or at least, sort of mystified on, how could you help my pet if I don't even come in to see you, kind of thing. So we do spend time explaining to people how that can work. But a lot of people already get it. They're like, wow, this is great. I know this can work. In a veterinary or a pet situation, in contrast to, using it for yourself and us using it for our human selves, it's got even another nice dynamic to it, in the fact that the pets don't have to travel far. A lot of times, like you said, if you're going to a holistic expert or whatever, you're, oftentimes traveling. So you got the travel time, and then you have the stress of being, in the office. And I find, because my appointments for a first-time patient are 60 minutes long, because really, for us to get good success and a good outcome, we need to allow that time to really get into detail together, discuss detail with the pet parents. And 60 minutes in a room for a pet, and even for, the pet parents, that is a long time. Then you got the travel time to check in and check out. And we found that it could be like a 3 to 4 hour experience for people, and it would get overwhelming. But, if they're doing it from their home, you skip all the travel, you skip the pet stress. People are super relaxed. The great thing is, they don't have to bring in their whole bucket of supplements that they're doing. They can just put it beside them. This is what I'm doing. It makes everything so easy. And they'll go to the kitchen. They're like, okay, this is the food I have, and this is what I'm doing. And it's a fun, interactive. I mean, honestly, it's a lot more fun than being in the office. And then I can get into also the effectiveness of what we do in our sessions that make it so effective, but even just sort of giving everybody the scope of how it can work, in sort of the layout of it, is tremendously positive. So people love it.
Not to mention, I mean, doesn't matter how wonderful and great of a vet you are, it is stressful for pets to go to them. I mean, it's a stressful place.
Yeah.
And if you can keep that off of the table,
right.
It makes it easier. Obviously, there's less you need to go for, but
yeah. And most holistic and integrative veterinary offices are certainly far less stressful than the typical, conventional practice. But still, there's still stressors, and some pets are less stressed than others, obviously. But again, the length of time that you might be in an integrative center, because I mean, here, let's make a distinction between typical, regular veterinary medicine, conventional veterinary medicine. You're going to have a 15 to 20-minute appointment tops, unless you're seeing a specialist. Maybe if you're seeing an internist or a cardiologist, you might be there for an hour or more. But if you're seeing your primary veterinarian and general veterinarian, your appointment time is quick. And when you're going to an integrative veterinarian, usually, your time there is going to be expanded, because by the nature, obviously, of what we do to get success. So yeah, it's pretty cool.
Would you explain, if there's anyone in the audience who isn't exactly clear what a holistic vet is, what you guys do, would you talk about that? And also, like, your veterinary background, because I don't think that I think people think you guys are totally different, and that you might have gone to different vet schools and things like that. Would you kind of explain that really quick? And
absolutely. Thanks for
holistic veterinary.
Yep, I do think that's a really good thing to clarify for everyone. And so every veterinarian will have gone through the standard, courses of veterinary school, standard, school time there. And then after we, graduate from veterinary school, then it's up to us, kind of what niche we want to get into. And broad niches, you would be talking like small animal, meaning domestic pets, versus large animal, meaning, farm animals and horses, et cetera. And then you can certainly get into other, brackets from there. As I mentioned, I did wildlife and exotics. I did shelter work, all that kind of stuff. So there are many different obviously areas within veterinary medicine that we can, practice within or settle niche, but we all get trained with the same veterinary school training. And granted, every school might have a little bit of different nuances in their clinical courses, et cetera. But for the most part, it's pretty standard. And so I do, of course, believe that I am a better holistic and integrative vet, which I can define in a moment. I am a better holistic veterinarian having done 15 plus years of, Western medicine and conventional medicine, because you really need to know both sides in order to be the best value for your patient and your client, the pet parent, because, there's a reason, I always tell people, it's not like we're throwing Western medicine out the window. We want the capability to wisely use and thoughtfully use all of the assets we have at our fingertips to support our pet's health, or our own health for that matter. And you certainly want conventional veterinary medicine. So, it's nice when your holistic vet obviously has a very good background in that too, so that they can pull from not only the knowledge of knowing how these diseases get diagnosed and treated on that side of things, but also integrating any actual current time plan for that pet. Because of course I get pets that come to me all the time on, online, on telehealth, or potentially in person, where they're on medications already for, certain conditions, chronic conditions. And a lot of times pet parents, one of their goals is to get their pets off medications, or most medications, or decrease doses if possible. It's really important that I understand all of that aspect so that I can guide people through that, guide the patient through that. And so it is so important. When it comes to defining a holistic or integrative veterinarian, integrative is a nice term because it really portrays that we are using integrative methods of, Western, Eastern, holistic, nutritional medicine, functional medicine. I love that term. We're integrating all of those things. Whereas, holistic, I guess, gets a little bit more into, at least conceptually, gets a little more into where we're really using natural things to support the body. But I love the word holistic in the sense that we're thinking about the whole body health. Often in conventional medicine, we're segregating, like, okay, there's a cardiac problem, there's a heart problem, there's a gut problem, there's a, pancreas problem, whatever, and not really linking all of those systems together so much. And so oftentimes conventional medicine will compartmentalize things, whereas from a holistic approach, we're really treating the whole individual, the whole body. And sometimes there's priorities in that, regimen, but we're really looking at everything. And that is so important to achieve true health and maintenance of good health. So, yeah.
I think that's great. And like you said, not replacing the other vet too. I know myself, I have my traditional vet that if I need surgery or I have something that needs to be fixed immediately, I call him. I have my integrative vet as well. She does acupuncture and herbs and chiropractic and all the other things too. So I think it's great. Jessica Fisher and I talked about this recently on one of our Facebook Lives. It's good to have like an arsenal of people that can help your pets. It's
Yep. An art, like it takes a village to raise a child, and it takes a good medical care community to be at optimal health, honestly, for humans too, and certainly for pets. So I'm really glad you sort of brought that back into, my description, is that we always tell our clients, you definitely need a primary veterinarian plus or minus a specialist, sometimes obviously, or even a few specialists, with complex things going on. You need those players in your pet's healthcare team. They can be, ultra important, critically important. But what the value of, bringing integrative and holistic in is that if you're in acute or crisis phase, like if the pet is really ill and you need something, done right away, whether it's trauma or whether it's just a chronic disease that sort of tipped over into all of a sudden now the pet's in sort of crisis with symptoms, then oftentimes you want your Western medicine veterinarians helping you in that phase. But where Western medicine often falls short is the chronic phases. The how do we
Right.
get them back? How do we get to the root of the problem and get them back to true health? That's where it's so beautiful to bring the holistic and the integrative in, is for more of that long-term care and the support back into, full body health and balance, which, so you get your initial phases often through Western medicine, and then you get your more, long phases or true healing through, the other. And putting them together is the biggest win for everybody.
I think it makes sense, when you think about us as humans, we don't have typically just one doctor. We have a team of doctors. We have our primaries. We have our nutritionist. I mean, it's in the world for animals, though, we tend to have one vet and, nutrition information. There's so many other things that, my vet is the first to tell me I am not super great with the nutrition aspect, but, I can, cut them open and do surgery all day long. But, he admits that. And I think that's great, where having that integrative vet and specialist and everyone to come into play to help, in different stages of life and different stages of problems,
I
or
agree.
in your case, to help keep them in a lot of preventive care. I think preventative is great as well. So
Exactly. That's the goal. But I like how you said that too, because I am finding that there are more and more veterinarians who are primary vets, conventional vets, that are starting to support, like, just being very, open to, this is my expertise, and nutrition's a little bit out of my wheelhouse kind of thing, and being more open to the pet parents that are in their clientele, being open to supporting them to get care outside of their knowledge base elsewhere. A lot of vets are becoming much more open with people having a team, a healthcare team for their
it's
pet,
great.
and that's most
Important.
appropriate, most successful. Yeah.
So in terms of what you do, I'm in Virginia, you're all the way in California, and I need help. How are you helping me? Like, it doesn't make sense, right? Like, don't
Right.
don't you need to see my dog in person to help me? Or what do we do?
Right. Yeah. So let's walk through it. I love it. Pose a scenario. So, and again, many of my clients are all around the country, sometimes even international. And when we meet with people, I mean, I'll back up and just remind that when I first meet somebody for, working with their pet, each pet that I would meet, we would have a 60-minute consultation that we schedule online. Sometimes we use the phone if internet isn't really available for that person, or they prefer a phone consult, and that's fine too. But we schedule a 60-minute consult. In preparation for that consult, we do all of the ability that we can to recruit in and get any medical records that are available, certainly that the pet parent thinks are prudent for the situation at hand. So we do our best diligence to either have the pet parent send us any prior lab work and veterinary visits that we should see, and or we reach out to their veterinary hospitals and request it. Okay, so we do our best to get all of that ahead of time, and I spend a significant amount of time reviewing all of that for my patients. I can't be of high value to people if, or at least a lot less value, if I'm not reviewing all that information, because then I step into our conversation having a lot of background, and we don't have to spend a lot of their session time going through stuff that I can learn ahead of time. So that is really key. And then the other key part about that is that piece of it is also one of the reasons why we can be so effective with telemedicine or telehealth, is because the vast majority of the time, I'm getting a lot of records. I'm getting records on lab work that could be recent, that could also be a couple years down the line. I do comparisons, like, what are the trends of this lab work? What did this pet's test look like last year or the year before compared to what they look like now? I can see radiographs. They can send images. They can also send radiology reports and ultrasound reports and physical exam notes. So a lot of my patients have seen a veterinarian or a number of veterinarians within the last several months before they come to me. So I get the luxury of getting all that information. So even though I'm not putting my hands on the pet, there are a lot of veterinarians that have put their hands on the pet recently, and I get to read all of that data. So it's really like sometimes even better than me being able to do it, because I have a massive information from several different people that have done it, and each doctor might have their different input, whether it's an internist or, et cetera, et cetera. So I get a lot of information. So it really helps me to get into a guidance plan using all of that, and then using a 60-minute discussion time together where I'm really diving into details and asking pet parents very specific questions that, from a holistic or an integrative angle, are so important for us to figure out what a good treatment plan will be for that pet. And I would wager to say that oftentimes I am getting more information out of a telemedicine session than veterinarians get out of a physical exam. And when you
Well, the
think about
dog's
it,
not there to distract things either.
you're right. Yeah, and
Yeah.
that's the actual real component of it. So I appreciate that you recognize that, because there's so many distractions in an exam room. And if the pet's nervous and, et cetera, that can add to it. But also the time, again, a lot of veterinary exams are 15, 20 minutes, and, we're here 60 minutes talking. And a lot of conventional sort of approaches don't get into the finer details of things like a holistic approach would. So I'm spending time asking people, I have all kinds of questions, even just within the digestion topic that I want to talk about.
Mhm.
Not only do I want to know what stool quality is like, how many times a day do they go, what is the upper GI symptoms? Are they eating grass? Are they lip smacking? Are they throat retching? If these things are happening, are they happening in the middle of the night? Are they happening during the day? Like, I get into nitty gritty detail that is so helpful in deciphering exactly what's going on. And oftentimes, just for instance, just to make a comparison, in my experience, the majority of the time that there's no obvious respiratory issues, if a pet is coughing or retching, or throat gagging, especially if it's at night, middle of the night, early morning, is classic time. If they're doing that, the vast majority of the time, that is a gastric cough. That's like from reflux and from, stomach issues. A general veterinarian might just, question a pet parent and say, oh, what are they? And their pet parent would be like, oh, they're coughing, and they're like, oh, they have a respiratory issue. And they may even prescribe antibiotics. I mean, they may, because, and nothing against them. I mean, that would make sense with a cough, but oftentimes they don't have the time or even sort of the knowledge or level of expertise to really dig into asking the pet parent very detailed questions to elucidate really what's causing that symptom. And that's where I feel, holistic. And I guess I'll just say one more thing that kind of might portray this for everybody is I get all the time, and one that just is fresh in my mind, because I meet with her pretty regularly. One of the pet parents that I work with, is she found me because of her dog that had IBD, and she has 2 dogs now, and I've worked with both of them, and her dog's IBD is completely resolved. This dog is like 100% normal and thriving. And there's a Facebook IBD group, and she always posts stuff on there like Dr. Kangas is amazing and help my pets. And she says what I love to relate everybody today. She says, I still can't believe sometimes that my pet achieved complete health from a very significant state of illness issues, and we've never met in person. And she's like, I had been to like 7 other veterinarians, and I didn't get full success until I met you, and all those other veterinarians we saw in person. And then she's like, and then I meet somebody who we only work with telehealth, and my dog gets complete resolution. I mean, what a beautiful, just display right there.
I mean, that goes back to having your team in place, though, and you spending that time to ask questions. I know my conventional vet, I mean, as I said earlier, there's not enough veterinarians. They can't keep up. I mean, they would not physically be able to do a 60-minute consultation and, to
Right.
find out all these things are already backed up. So once again, I think that's where, you have your team, someone like you is spending all this time to piece all of the pieces of health together.
Yep, well said. That's so true. They don't have that kind of time. It's not really in the system or format of a
No.
primary practice. So it makes perfect sense of why you'd have to seek another team player, another, healthcare team member to put those pieces together. So very well said. And then the other thing that, we can bring in the value of your conventional, primary doctor is that they're there to assist you also with getting the diagnostics done, because I
Correct.
become more valuable to my patients and my clients the more diagnostics and the more information that I have, whatever testing has been done, then I have the luxury of having all that information to help them with moving forward from where they're at. And so if pets come to me and some of the tests that I think are really worthy for them have not been done, then I recommend, hey, go back to your primary or your specialist, if you're seeing an intern or similar, and get some testing done. Let's do these kinds of things so that I can help further. And then the other tests that are, which a lot of holistic practitioners use that conventional vets don't use, they're out over the counter tests. So I love to recommend nutrient testing, like vitamin panel testing, for instance, from the VDI lab that a lot of holistic vets use. And so we test for levels of vitamin D and vitamin B12 and folate and magnesium and even omega-3 fatty acids. I love checking nutrient levels because many pets and humans are deficient in critically important nutrients that are affecting long-term health. And those are easy fixes. Like if we always want to get into, the best diet we can do and everything. But if somebody's really low in vitamin D, that is not doing you any favors. And that is promoting even, more inflammation and chronic disease. So that is an easy fix to get a vitamin D supplement in at an appropriate dose to bring those levels up. And then it makes everything else in our plan just more effective for that pet. So I love deciphering those things. Other tests that I encourage people to do, depending on the situation, maybe a food sensitivity test, like the NutriScan test or some of the similar, or the animal biome test, or fecal microbiome testing, and then sometimes like a complete thyroid test doesn't often always get done by a primary vet. They might just do a thyroid level with a T4, and when we do a complete profile, we may find more of a specific diagnosis. So I do send people back to their primary vets and their other vets in their healthcare team to say, hey, let's get these done. And then when you get the results back, you can get their interpretation, get the side of things from their expertise, and then you can meet with me again, and I can weigh in on it from an integrative holistic standpoint, and we can start to really put a thoughtful, comprehensive plan together for your pet based on all of that.
Do you find that traditional vets push back on these tests? Like someone comes to you and you say, here's my list, I want all these testing. They go to their vet. What is their vet saying?
That's a really good question, Amanda. Thank you for bringing that up. There can be some resistance. The neat thing is there's less and less of that. I really would say at least 90% to 95% of my clients that, report back to me, their veterinarian was cooperative with, submitting those tests for them, getting the blood draw done. And a lot of times they have to order the test kits from us. Like their vets don't carry these. So they can order the vitamin panel and the omega-3 tests and stuff, and we ship it to them. And it's very simple for, the veterinarian drawing the blood or the vet team drawing the blood, and they can just submit it out for them. Most people are cooperative. Every once in a while, people will report back to us, my vet was resistant to that. They didn't know anything about it, so they felt uncomfortable. So they're like, no, we're, not going to do that. But that's honestly, it's pretty rare. And the other neat thing to know is that those blood tests, you would have to rely on your vet, team to do a blood draw for you. But there are a lot of tests that pet parents can submit on their own, that they don't need any assistance, because the microbiome test is just a stool test. The like a food sensitivity test is generally a saliva test, things like that. So there's a lot of things that pet parents can do without having to even recruit a veterinary office to help them. And then the results they get back oftentimes are user-friendly enough where they can work through things on their own. For food sensitivity. For other tests, then they can make a consult appointment again to just review all that together so that I can help them with a plan based on all of that.
And I see Lisa just commented here that she's done a lot of the test, and that she didn't know how to interpret the results, but that's where you came into play, which is great. We carry the Innovative Pet Lab test in here, and they're very good about saying, like, what you can and cannot do or what you should be adding. But even that is a lot sometimes. So people will come to us and they'll bring us their thing. And so even we'll guide people to the supplements or whatever. But it's great to be able to use someone like you to interpret it, down to a more, finite science. So
yes. And not only interpreting, and I'm very familiar with the IPL test. That's a wonderful, gut health test. Not only interpreting it, which is obviously of key importance, but also getting more information from the pet parent as to okay, we have these results now. This is our current snapshot in time. But what have you been doing for your pet as far as like supplements or diet prior to this, so that I can weigh in on where's the best point to go from here? Because I always love to tell people, I'm not here to reinvent the wheel for you. Like, if you've done all these things and they've, worked or not worked, we don't need to rehash through those. Let's find out, but it's good for me to know what has been done so that we can go to the next level with something that, makes sense to add in, complement, and fine tune from where they've been. So yeah, it's really nice I love, getting all those pieces put together, and I love empowering the pet parent in that whole discussion and supporting them to be the best advocate for their pet by really talking them through this, so they feel very solid about a lot of the information, so that they know when they're making decisions, they're more informed.
That's great. What are people coming to you for? Like, what are the type of services that you can do with telemedicine?
Yeah, thanks for asking that. I mean, really, there's really not much we can't do other than, like I said, the hands-on of drawing the blood and doing the imaging and, ultrasounds and that kind of thing are clearly surgery. But anything that either has any chronicity to it, where people are still like in a management phase of trying to figure out how to either maintain the pet, from being lesser symptoms or symptom free, or wanting to, having the incentive to get them to true resolution of the issue. Obviously, that's it. Anything chronic, even something as simple as like the pet has cardiac disease and they have a heart murmur and they just went for a cardiac ultrasound, or they go every year or whatever, and it's either not been recommended for heart meds yet, the pet's not at that stage, or the pet's already on heart meds. The client may, check in with me to say, hey, these are, this is what's going on with the diagnosis. What can I do from the holistic and nutritional side to support better cardiac function, more longevity of my pet's heart, more ability to be able to, exercise at appropriate levels, etc. And so even just like you said, preventative, even once there's something already there, is really helpful. I will tell you that I have evolved into a niche of gut health and really kind of standing out as a bit of a gut health expert, because it's been such a passion of mine to address that, because gut issues are so common now in pets and humans. And we now have a very clear understanding that gut health is the foundation of health, which has been, the age-old Eastern medicine concept anyway, from Hippocrates and Chinese medicine. We know that true health or whole body health is rooted in gut health. But now in today's age, gut health is such a mess oftentimes, for a lot of people. And so it really became a passion and focus of mine. And so over the last few years, I've actually done a lot of teaching and writing on this. And I gave 3 lectures at the American Holistic Veterinary Medical Association, so our big holistic vet annual thing each year. And I gave 3 lectures this last year, and 2 of them were on gut health. And so the beautiful news is now I have other veterinarians referring to me as well, because they got a lot of that information of, wow, there is a lot of things we can do beyond what most of us are trained with in conventional aspects. And so, for instance, then to answer your question, when these pets come to me, we work through what they've been doing, what responses they've had, and what we can now add in or change or alter to start progressing that pet back to better gut health.
Yeah.
And in many circumstances, I am able to slowly, not overnight, I am
No.
able to slowly support people to oftentimes remove some of the medications over time as we or after we implement some very specific strategies. So
Mhm.
it's really exciting seeing, seeing that conversion, and it's such the biggest reward in what I do, is having people report back to me that their pet is back into health. And sometimes it's a process. Sometimes it happens quickly, and it's like our first session and everything just goes super seamless, and I give them like a list of, by the way, I do give everyone a very detailed wellness plan. So that is a
That's
big part of my value to people, and I spend a lot of time on it because I think that one of the reasons my patients get such a high level of success, overall, is because I'm very thorough, and I put time into customizing a plan for each one and having it bullet pointed out in a preferred order with pacing in between things,
mhm.
very thoughtful to support the pet parent into action steps, because they can listen to me talk about all these great things that that are good potentials for their pet, but if they don't have kind of an easy, user friendly, like, go-to plan, like, okay, what do I do out of all this stuff that you just told me about? And so I provide that, and when people are following that, sometimes I always recommend a follow-up in 1 to 2 months ish to reconvene and keep going with fine-tuning plans. Every once in a while I'll have people that'll contact us months later about another, oh, I want you to see another pet now. Well, how's Fluffy? And they're like, oh gosh, everything you told me just worked great. My dog, that dog's fine, like, that dog's doing great. Now I want to work with my other dog. I'm like, what? Like, one and done, that's awesome. So, sometimes one session and things just are super smooth, but oftentimes with complex or chronic things, it's going to take several sessions to work through. So I always kind of prime my clients to just be, expecting that we're going to need a few follow-ups in order to really support them to get things dialed into where we're going to get good success.
Well, I always say this. Most of these conditions didn't happen overnight. You're not going to fix them overnight. And everyone wants instant gratification. Hello, metronidazole. I mean, like, you want, instant gratification. You want things fixed, but it didn't happen overnight. And, back to the whole gut health thing. I mean, how true. I think me in a pet supply store, people come in all the time. It's like, I need a probiotic because my dog's gut is messed up and it's having diarrhea. I'm like, but why? Like, I can give you a probiotic and it can give you things to make it, fix and you can manage it. But why is that happening? Like, and I think in terms of integrative and holistic veterinarians, you guys look at why it's happening. So let's not stick a band-aid on it to fix it temporarily or just make the symptoms go away. Let's find a resolution to actually cure it and make it, better all the way around. So you don't need those things.
Exactly. Thank you. And so well said, Amanda. I absolutely agree. And, we know that Western medicine tends to sometimes be the more band-aid approach of, let's just address the symptoms. But it's nice to kind of put into perspective that even from a holistic angle or a holistic approach, it's still nice to, like you said, get to the whys, get to the cause, the root cause, because there are some great herbs and tools that we can still band-aid with. And it's nice to band-aid with a
Yeah.
natural tool versus a chemical prescription tool.
Yeah.
So, that's still a plus. But rather than just using the band-aids and just adding in, an herb and a probiotic, which are not a bad thing by any means, they're great, but let's try to get to the why so we don't have to keep reaching for the treatable thing at that moment where we
Right.
get back to homeostasis and we don't have to look for treatments.
That's awesome. I see we do have a couple questions, and we're at 40 minutes right now, so we're going to try to wrap this up somewhat soon. But Melissa wants to know, speaking, if you're comfortable answering this, speaking of vaccines, would you mind sharing your opinion on a dog with a history of seizures receiving a rabies vaccine?
Yeah, I would really want to avoid any further vaccines for that dog. And I mean, all holistic integrative veterinarians, we are going to be in the camp of minimizing and avoiding, certainly, adulthood vaccinations. And so I would always advise people, and we'll get to the rabies, but just to give a little scope of the whole vaccine topic here, is I would always advise pet parents to do vaccine titer tests before ever vaccinating, to just verify if the pet truly does have protection, because most of the time they will. And then you don't need distemper and parvo because you can prove that they already have good antibody levels to those viruses. And vaccinating somebody who already has immunity doesn't make them any more immune. You either are immune, you have immune cells, or you don't. And so there's no reason to take on the risk of a vaccine if you already have immunity. So the risk benefit ratio is clearly not in a good place at that point. So adulthood vaccines, most dogs don't need most of them. And it is important to factor in their lifestyle and their exposure in, the region of the country and stuff like that. But even so, there are some or many vaccines that are available, that are made, that aren't that effective. So even if that disease is endemic-ish in your area, you can't always expect that the vaccine is totally worthy in preventing the disease anyway. So again, you want to talk with a holistic or integrative veterinarian who really has a deep scope on this to help guide you through what vaccines could make sense or not. But I will say, as sort of a blanket rule, most of them are not necessary or avoidable in adult years. Okay, but not 100%. So that's always a good thing to customize. When it comes to rabies vaccine, which was such a good, question, rabies vaccine gets a little more sticky as far as pet parents making choices, because there's no other vaccine where there's any regulation over it. Like, if you don't vaccinate your dog for distemper and parvo or whatever, as long as you're not traveling, you don't need a travel certificate. Nobody's policing that. That's just your choice. But when it comes to rabies vaccine, because rabies is zoonotic, meaning it affects humans and is generally fatal, communities and the legalities of communities have that one under, on taps. And so they want to see that the pet population, especially dogs, some communities don't, monitor cats, but that the pet populations are vaccinated so that we know we are, not exposing a big risk to the community of domestic pets spreading these things. So most communities, but not all, I think, will allow a veterinarian to write an exemption request for, the rabies vaccine, and then it goes up for approval, and they either approve it or don't. Fortunately, in my area, my local area, San Diego County is really reasonable with approving, medical exemptions. So I write a lot of them. Some communities aren't as, open to approving these. But I would, to speak directly to that question, I personally would absolutely avoid a rabies vaccine in somebody who has a history of seizures. And what the pet parent can do is do their best to get the medical exemption request, submitted and hopefully approved. That is definitely a valid reason to approve that. Okay, definitely justified. And then the other thing that the pet parent can do is a rabies vaccine titer test. Okay, to verify that the pet does have protection against rabies if they were exposed. Now, some legal communities like San Diego won't recognize that in lieu of, vaccinating in order to get their licensure. They won't, but it's still a very valid document. I mean, these are very valid tests that are done now, and recognized for international travel and all kinds of stuff. So at least it gives the pet parent, a valid document in the pet's file and their own peace of mind that if they're foregoing the rabies vaccine or getting a medical exemption or whatever, that they know their pet is actually protected, So I would cross those bases too, just so they can feel really, really complete in their attention to it all.
And I like to say, your integrative and holistic vet are not the only ones to do titers. Your regular vet will do a titer. They don't talk about it typically. They don't usually offer it, but you can ask for it. My vet did it for me. I know I can only speak here, but I know there's some vets here that push back on it. Remember that, like, you are the client and you are your pet's parent. Like, advocate for them. Say, I want to do this. If you don't do it, I will find someone who does. And they're charging you for it. They're making money off of it. So ask for it. It's a good option. Like, why give your pet something that it doesn't need if you can just find out, hey, it doesn't need this. I'm going to do this test here and not inject something else into my dog. I think it's very, or cat. So yeah, ask for the titers because it's not something that is, written up there that they offer. So ask for it.
Exactly. And you are correct, Amanda.
Yeah, so you did tell me that you got big.
Yeah, in my experience, most veterinarians, of course, when people request, will run a titer. Every once in a while, vets may still refuse to, but that's rare. The other little tidbit that I could add in here is if people want to, are able to, you can self-order as a pet parent consumer. You can order tests from the Hemapet lab, which is Dr. Jean Dodd's lab. And she's the one that offers the and food sensitivity test, and she offers thyroid tests. Of course, she's like the endocrine thyroid guru veterinarian, but she also offers titer tests. And I will say that I favor her testing over standard veterinary labs. And whatever way you can get a titer, get whatever test you can get. But if you have an option, requesting your veterinarian to submit it to Hemapet, or the pet parent can actually call Hemapet and say, I want to order this test. Now they still need a blood draw. They still need to accomplish the blood draw to send it in. But they can actually order the test themselves. And one of the reasons why I like the tests there is because it's much more accurate in the reporting system that Dr. Dodds uses as to if the pet is really protected with antibody level or not. Instead of just a positive or a negative, it gives a grading where another lab might say that it's a negative titer, and Dr. Dodds' lab, the calibrating is done differently, and it will show that the pet is protected. So, sometimes there's a little bit of lab discrepancy, but more often than not, and more often than not, they're going to match. So I don't want, people to think that doing a test elsewhere has no value. But if you have a choice, or if your pet's test comes back that they're not protected, you might want to back that up with a Hemapet test because you can see different results.
Great idea. That's great. So, a couple things. We can take maybe like 2 more questions. Also, if you are here, make sure you comment. Tell us you're here. Comment with the hashtag the more you know, because in a few minutes we are going to raffle off some of the Forever Dog Life books. Julie, Virginia does not recognize titers for rabies, but they do recognize it for other things. So, but yeah, unfortunately, but you can still have it done and know where you stand. So I think that's important to put out. Does anyone have any other questions while we're
I'm going to say thank you to Melissa, and Julie wrote kind of a good comment. Donna's already aware of Dr. Dodds and said she has a reasonable rate for rabies titer. So it's nice people are, already having awareness and thought process through all of this. So that's great to see.
Yeah, that's awesome. Yeah, Lisa says she misses you. Thank
you, Lisa.
Yes. All right. So I'm going to let everyone, Martina wants to know, what about the DTF rabies vaccine?
Oh, it's the thimerosal free. So that is the one that you always want to choose. So there's a rabies vaccine, I think, and I may be wrong. At least at first, the only brand that was doing thimerosal free was IMRAB, which I believe is Muriel, company. But anyway, IMRAB TF stands for thimerosal free, which means mercury free. So if you are doing a rabies vaccine, you definitely want to tell your vet that is the vaccine that you are choosing, and get that one because that is safer. Mercury is often used as an adjuvant. The adjuvants are the things that they put in there, with whatever antigen to, stimulate the body's immune response to make antibodies. The adjuvant is often a chemical that is seen as a very kind of, warning to the body, like danger, danger, because it's trying to stimulate the body to make antibodies. And if you deliver a killed vaccine, meaning a killed virus, the body's a smart, innate being, right? So it'll look at a killed virus and go, well, it's already dead. Like, why do I need to make antibodies to that? That's not threatening me. So they put these high-powered adjuvants in to sort of like zing the body to go, yeah, look at me, make an antibody. And so mercury and other adjuvants have been used, historically, aluminum, etc. But to date now, this TF vaccine, thimerosal free, is the safest rabies vaccine because the adjuvants are much safer. So, and then regardless of any vaccine, certainly rabies for sure, but no matter what vaccine your pet is getting, I would always advocate for a follow-up with a vaccine detox with a homeopathic.
Yeah.
So
thank you for saying that. Yes.
Remedies. And there are many out there, you know, that are even put together. Adored Beast has, you know, Rebalancer, which used to be antibacterial. Yay! And that is Thuya and Silica together, which is wonderful for lymphatic drainage and, you know, post-vaccine and, you know, other rebalancing and detoxing. When it comes to rabies, the homeopathic formula that is generally chosen very specifically to detox rabies is something called Listen or Licinum, the full, you know, term. And that is a great thing to do for a few days after a rabies vaccine is given, if you have to give it. So.
I'll take 2 more questions here that I'll read really quick. Sherry would like to know, do older dogs get distemper?
Rare. It can happen. And if it is going to happen, I'll just make this distinction for you. It's almost always a young, you know, dog puppy issue. It's rarely a middle-age issue. There is, I mean, it's been so many years since I've seen this at all. But there have been some uncommon cases of an older pet, you know, getting distemper. But, you know, I mean, I might have seen that twice in my career of 30 some years and not for a long time. So the likelihood of that is very low. And so, okay. But, you know, testing distemper and parvo titers, you know, every 3 years is considered a really good frequency of, you know, checking in on time. You don't have to titer test every year. Even the, you know, the AVMA really backs, you know, titer testing every 3 years. So that's a really good thing to do, just to have peace of mind that, you know, your pets are retaining protection for those things.
That's awesome. Thank you for that. All right, you guys, we do have to wrap up shortly because you have some clients to get to shortly, but we do want to raffle off some tickets. So really quick, not tickets. We're not raffling off tickets today. We are next in a couple weeks to the summit. However, comment with the hashtag the more you know. And yeah, let's bear with me. Let me get this going here. Dun, dun, dun.
Some of these comments, thank you.
All
right.
I just want to. Let's see here. All right, let's draw the first one. Dun, dun, dun. I feel like I need like some music that goes along with this. Rita, you won a copy of the book here.
Hi,
Rita. Awesome.
Congratulations.
Right. And let's do one more just for fun. Because everyone needs this book. It's absolutely amazing. If you don't have this book, go get it. It's great.
Love this.
Jessie Kendall Fanning, thank you so much. Here is our other book. So if you did win any of these today, send a message to the Nautical Dog. We will we'll get that book to you. If you're local, you can pick it up in the store. Otherwise, we can send it. So that is the Nautical Dog. In terms of how to find Dr. Katie Kangas, you can find her at the website here at intvetcare.com. She's also on Facebook and Instagram. If you are one of the lucky people who were able to snag a ticket to the More You Know Pet Wellness Summit, she will be there. They will have a booth there sharing lots of information. So please make sure you stop and say hello to her there. Send them a message through their Facebook, email. You got it. And thank you so much for coming on. I really, really appreciate it. And I'll see you in less than a month now.
Thank you for the opportunity.
Thanks to everyone for coming.
Yes, thank you.
Thank you. Have a good day, everyone.